The City of Columbus has invested in alternative crisis response, combining experts in mental health, substance use, social work, and law enforcement for tailored community solutions. Today on City Chat, Councilmember Melissa Green is here to discuss the efforts behind this work. Thank you, Councilmember Green, for coming on to City Chat today.
Thank you so much for having me back.
So, can we go into, can you just explain what the alternative crisis response is and how it came about?
Yeah, absolutely. So here in Columbus, we've actually been doing alternate crisis response in various different forms for a really long time. Okay. Essentially, when we talk broadly about alternate crisis, we're talking about any sort of emergency response that either involves some form of alternate engagement with police or maybe a non-police response. Here in Columbus, we're working really hard to build out a continuum of crisis care for our residents that would be able to meet people's needs in crisis where they're at. They started realizing across this very high utilization population of people who are just frequently calling EMS, that the majority of them were already linked with an external provider. And so figuring out how do we bring in social workers to tap into that and connect them. And then, in 2014, 2015, who would have expected the way that the opiate crisis is going to start bearing down on our community? And so, from there, we were able to develop the REACT program, right? Where we could send out people who are highly trained in law enforcement and EMS and paramedics, as well as social workers. And then, of course, now we have moved towards even more robust models of support for people. Yeah. Addressing those 22,000 mental health related calls, we stood up the Right Response Unit that is able to triage those calls in real time and has we've seen not just the positive life outcomes for people that are getting the support that they need when they need it, right? Yeah. But a 40% reduction in police needing to be dispatched just from having a phone conversation with somebody. Wow. And so I think it's I think it makes dollars and cents, right, for our city, for us to be investing in this type of work.
What role do the specific experts play in these programs when we're talking about different needs in our community? Because, there's not one size fits all. Yeah. Can you kind of speak on that?
I think there's a lot of power in having multidisciplinary teams, right? I think for me, I'm a licensed social worker, and I would not want to be handed a badge or a weapon of any type and sent onto the scene of a bank robbery, right? Yeah. I've not been trained. I don't have the skills to be able to do that. And the same is true of a person in our community that's experiencing psychosis. It could be a pretty dangerous situation for someone to arrive on the scene of. If they don't have the right skills to be able to engage in trauma-informed care and de-escalation. And so with our latest alternate crisis response program, kind of the one that I think most people look at, is our mobile crisis response unit, our MCR unit, where it's another co-responder model where we have embedded social workers from Columbus Public Health with our police officers. Oh, wow. Who are able to go out there as clinicians and respond in these situations. What we have seen is that unit just itself has been able to offload 14% of those police runs for mental health related calls. They've never had incidents of deadly force being used, are able to really come in using their lens and their expertise to solve these really, really challenging issues.
These collaborative programs across departments, overall, can you just explain how it improves the crisis response?
We have really incredible partners that we're collaborating with across the community who are able to then provide entirely non-police responses. So NetCare Access here in Central Ohio, who's been doing this work for decades, doing crisis response care, has stood up a completely non-police crisis response program that involves only clinicians and peer supporters and qualified behavioral health specialists. And I think that's, our collaboration with them is absolutely critical in making sure that people are getting needs met and addressed. We also have really strong partnerships with Nationwide Children's Hospital through their Mobile Response and Stabilization Program, MRSS, which is, again, a non-police clinical response for children and families in our community where they might be experiencing crisis. And so building out those collaborations and being able to integrate all of that work is going to be really important. And then, of course, here at the city, we've invested a lot, as well as our partners at the county and lots of other stakeholders around the community, in our partnership with the Franklin County Adam Board and building out the crisis stabilization center that is getting ready to open this year. And so when we talk about crisis care continuum, we talk about the 3 pillars: someone to call, someone to come, and somewhere to go. And that's going to be our somewhere to go, where if someone needs a higher level of care, if we're not able to de-escalate a situation in the community, we can take them directly to clinicians and behavioral health specialists who are able to help resolve some of those challenges. And so,
what is defined as crisis? Like, who is qualified to reach out for these lines of help?
Yeah, well, so in the world of crisis care, from the mental health side, we talk about there being a no wrong door policy, and so one of the standards of the Mobile Response and Stabilization Service, for example, is that the crisis is self-defined. It's defined by the family. It's defined by the children. We're not here to kind of gatekeep what constitutes a crisis and what doesn't. Right. If someone is experiencing a crisis, they call us and they're going to get a high quality of response every time.
Councilmember, thank you so much. Is there anything else that you would like to add?
We want you to call us at our non-emergency police number, which is 614-645-4545, and then it's option 3. Okay. And that will connect you to our right response unit. Those services are available 7 days a week, 365 days a year, from 10 a.m. until midnight. If you are in need of support after those hours, if you call that number, same thing, option 3, it'll connect you to the state's 988 call center, where they likewise can help, triage issues with you over the phone and connect you to some level of emergency response if that's what's needed.
I'm Josie Smith. Thanks for watching City Chat on CTV.